Dr. Karen Perry, Assistant Professor in Orthopaedics and Section Head of Small Animal Surgery at Michigan State University. In this brief video for canine arthritis management, I would like to touch on 3 areas where, if we placed more emphasis, I feel we could achieve better results for our patients. Firstly, I think we need to recognise just how challenging this condition can be. Because we manage osteoarthritis very commonly, it is often presumed that this should be straightforward. However, achieving optimal results for these patients can be very difficult. Secondly, I would like to emphasise the importance of multimodal treatment plans, tailored to the individual patient. And thirdly, discuss a critical but often overlooked component of osteoarthritis management: monitoring. Treatment of osteoarthritis can be a substantial challenge. It often feels like you are repeatedly trying to hit a moving target, and to be honest, that is often genuinely the case. There is no cure for osteoarthritis. Even with joint replacement, the osteoarthritis that exists in other joints will require ongoing management. Traditionally, the aim of treatment has been to palliate the painful symptoms of the condition. However, this can be deceptively difficult to achieve, as the goal is often variable, both within and between patients. This means that even with one patient, that patient may be experiencing different severities and types of pain at different times of day, and this may require alteration of their therapeutic regimen. There are many reasons why this is. Firstly, there is a variable degree of pathologic change both within the bone and the soft tissue. Secondly, the severity of discomfort is often inconsistent with the degree of pathologic or radiographic change. In fact, we have no test that accurately predicts how severely a patient's osteoarthritis will affect them clinically. We have all seen those patients with dramatic changes on radiographs who appear relatively unaffected by their condition, and patients with almost no radiographic change who are severely painful and lame. Thirdly, symptom severity is related to the recent use or stress that is placed upon the articular and periarticular tissues, genuinely representing that moving target that we mentioned earlier. And fourthly, patients suffering from osteoarthritis will experience both chronic pain, characterised as a dull ache, and acute sharp shooting pains. And these different types of pain will likely respond to different analgesics and treatment modalities. So, what does this mean? The wide range of factors affecting joint health and pain status make it difficult to provide a specific recommendation for the treatment of osteoarthritis that is applicable in all situations. In order to achieve satisfactory relief under these extensively variable conditions, multimodal therapy will almost always be required, and treatment plans must be tailored to the individual patient. This is one situation where one size definitely does not fit all. Owners must be counselled from the outset that arthritis is likely to be a lifelong process that will have to be managed. There will be flare-ups, dictating alterations in therapy, and these will become more frequent and likely increase in severity as the patient ages. However, there are many things we can do, more becoming available all the time, and with a balancing act between exercise modification, weight management, medications, physical rehabilitation, maybe eventual surgery, we can substantially improve the dog's quality of life. One often overlooked component of an osteoarthritis management protocol is monitoring. Our multimodal treatment strategy will need to be tailored to the individual and altered over time, and only through monitoring can the clinician know what is working and when changes need to be made. Monitoring may include subjective and objective measurements, including goniometry to look at the joint range of motion, measurement of limb circumference to assess muscle mass, lameness scoring, and, if available, force plate analysis. Questionnaires can be useful in assessing how treatments have affected quality of life, and they have been proven to demonstrate changes in response to treatment. There are many available, but one example for dogs would be the Canine Brief Pain Inventory. Activity monitors and accelerometers can also assist with monitoring treatment efficacy, and can actually be a really fun way of incentivising owners to continue with treatment. You could try setting up a leaderboard, for example, of the most active dogs in your arthritis treatment group. As alluded to here, not only does monitoring help a clinician with decision-making in whether to continue a given medication, add another, alter diet, or advise rehabilitation, it also helps in keeping owners motivated, hereby maximising their compliance during management of this lifelong condition. So, as you can see, while management of osteoarthritis certainly can be challenging in many respects, if we institute appropriate monitoring, make decisions based on the results of such monitoring, and build a multimodal, tailored treatment plan for each individual patient, I think we will start to see higher success rates and a greater percentage of these cases returning to an optimal quality of life. I'm Dr. Karen Perry for Canine Arthritis Management. You can follow me at KarenLPerryK for interesting cases, Q&As, and posts about all things orthopaedic. Sorry. That is horrid.